जॉय आवाज बंद कर दो।
बोलिए
बेटा गोइंग लाइव बेटा, जाओ तैयार हो जाओ। Good morning, everyone. Good afternoon, rather. Is it audible and visible? Okay, let's start with queries. Just give us a thumbs up if it is audible and visible. Okay, so let's start. Question number 1. First query is question number 1. Question number, just taking your queries. Let's see question number 1. Young female presented in the OPD with complaints of cyclical pain, secondary dysmenorrhea. What is the cause of cyclical pain, secondary dysmenorrhea? Yes. Yes, everyone, come up with the answer. So, what is the cause of? Just a minute. Hello. हाँ जी, एक मिनट. Joy, भैया is there, beta. Okay, so let's start. Sorry for the interruption. Now the question is that the The question is that for question number 1, this is there is secondary dysmenorrhea. The patient had secondary dysmenorrhea. What are the causes of secondary dysmenorrhea? Yes, come on, write down endometriosis. Yeah, so for the endometriosis, the investigation of choice is diagnostic lepro. Okay, any problem? Okay, diagnostic lepro. So can you tell me what other features? In the question it is also written anxious to conceive. Okay, in the question it is also written anxious to conceive. What is so sweet? What is so sweet? Anxious to conceive. In the case of infertility, again, the diagnosis is, in the case of patient of infertility, again, the diagnosis is, yes, the drug of choice is, yes, come on. The drug of choice is, investigation of choice is diagnostic histolepro. Diagnostic histolepro. Okay, is it clear? Is it clear? Let us take the another question. Question number 7. Question number 7. In question number 7, a picture is given, right? A pic is given in which you can see that uterus is enlarged. What you are seeing in that picture, that uterus is enlarged and there are lakes of blood. Can you see these two features? Right? And what are the complaints of the patient? Complaints of the patient is menorrhagia, dysmenorrhea and dyspareunia. This dyspareunia was given to confuse you. Okay, this dyspareunia was given to confuse you. Okay, is it okay? Okay, rest all are matching with adenomyosis. Right. Next query is question number 10. In question number 10, the patient is having endometriosis and infertility. Due to endometriosis, patient is having infertility. Okay, so now on laparoscopy there are severe adhesions. On laparoscopy adhesions are there. So what does this adhesion do? What does this adhesions do? These adhesions, they distort the anatomy. They distort the anatomy. So now if we want this female to conceive normally, then we have to normalize the anatomy and we have to remove the adhesions. Okay, and then we have to go for the IVF, right? Is it okay? Can anybody tell me why in adhesions we cannot do IVF? Why in adhesions we cannot do IVF? Just for the information, I'm telling you that the inflammatory cytokines released by endometriosis interferes in implantation. Okay, in even in IVF, implantation has to be done, right? So it will not be possible if endometriosis adhesions have not been treated. Okay, the next question is 14. Question number 14. Pain in fibroid. Pain in fibroid. The pain in fibroid is always due to torsion. The rare incidence in which pain in fibroid is there is, yes, come on, sarcomatous changes and red degeneration. Okay, sarcomatous changes and red degeneration. As you all have studied that there are many cases of fibroid in which there are many cases of fibroid in which there are fibroid size is 14 weeks and no symptom is there. What is in 90% of the cases of fibroid, the only symptom is, yes, come on, tell me. In 90% of the cases of fibroid, the only symptom is menorrhagia. Okay, the only symptom is menorrhagia. Let us take the 18th number question. Investigation of choice. I have told you this yesterday. 18 number is hyperprolactinemia. So, what are the etiology of hyperprolactinemia? Come on, tell me. What is the etiology of hyperprolactinemia? What is the etiology of hyperprolactinemia? Can you tell me? In hyperprolactinemia, first thing you have to do is rule out pregnancy. The second step is you have to rule out the drugs which cause hyperprolactinemia. And in the third reason is you have to rule out hypothyroid. Right? You have to rule out hypothyroid. And fourth condition is, yes, come on, tell me what is the fourth condition? Then you have to go for the prolactin assessment. And the reason can be microadenoma of pituitary and macroadenoma. Usually all the tumors they go with, usually all the adenomas they go with, what are the drugs we give for hyperprolactinemia? Cabergoline or bromocriptine. Is it okay? Is it okay? Now the next is question number 21. So question number 21 is, beta, this is a controversial question. 21 number question is controversial. There are two thoughts. One thought says that as the patient is asymptomatic, you have to do nothing, which I am also in this favor. The another thought says that as it is of more than 10 week size, if the fibroid is of more than 10 week size, then do hysterectomy, as it can cause cancer. But I think that if they are going to cause cancer, then the chances are only 1%. Why to operate a patient and for 1% chances? So that is why I am in favor of asymptomatic and do nothing. Okay, is it clear? Okay, you can go with your opinion. There are two pole of thoughts for this question. Okay, I have told you my. After 21, it is 26. In question number 26, it is that which fibroid causes retention of urine? Okay, which fibroid causes retention of urine? Because see, if this is cervix, this is uterus, then here lies the bladder. So only the cervical fibroid will cause retention. Okay. After 27, it is, after 26, it is 29. 20, after 26, it is 27. What is 27? Cervical motion tenderness. Cervical motion tenderness. This is seen if uterus, if there is blood or pus in peritoneum. Okay, blood in the peritoneum is seen in ectopic pregnancy and pus in the peritoneum is seen in PID. So when there is blood or pus in the peritoneum, then when we move the cervix, the peritoneum gets irritated. The peritoneum gets irritated more on moving cervix. Is it clear? So the answer is rupture ectopic, or yeah. Then next is question number 30. Hitesh, Dr. Hitesh, question number 30, please see. This is the favorite question of examiner, FMG examiner. Okay, this is favorite of FMG examiner. First, tell me in the chat box, what is the diagnosis? First, tell me in the chat box, what is the diagnosis? Question number 30. What is the diagnosis? Yes, very good, Dr. Isra. Pain in fibroid during pregnancy. Yes, during pregnancy. Then it is the reason of it is due to red degeneration. Okay, then tell me that what we do. What is the treatment of red degeneration? Conservative treatment. Yes, Dr. Rakesh Patel, you are right. Conservative treatment. Okay. Now let us do all the question related to this, since it was a favorite question of FMG. In which trimester we do this? Tell me, it is most common in which trimester? Red degeneration is most common in which trimester? What is the etiology of red degeneration? And what conservative treatment we give? Write down in the chat box, everyone. It has not been asked from last 2-3 years, but it has been asked 8-9 times. It is most common in second trimester. It is most common in second trimester. Okay, it is most common in second trimester. Please correct yourself. It is most common in second trimester. Write down the answer. What is the etiology of fibroid red degeneration? Why it occurs in pregnancy? Yes, Dr. Rakesh is right. Analgesics and antipyretics. Yes. Very good. And what is the etiology? Can anybody tell me what is the etiology? Yes, Dr. Isra is right. It because the fetus causes thrombosis in the vessels which are supplying the fibroid. Okay, because there is thrombosis of the veins in the capsule. Okay, let us take another question. Question number 35. Dr. Tanu Dagar. Dr. Tanu Dagar, please see here. Question number 35. This is acanthosis nigricans. Okay. What is Heron syndrome? Can anybody tell me what is Heron syndrome? HA stands for hyperandrogenism. IR stand for insulin resistance. AN stands for acanthosis nigricans. Darkening of the skin. Darkening and velvet texture. Of the skin. Okay, so as you can see, it is written in the question, hirsutism is present, so it is hyperandrogenism. Acanthosis nigricans is manifestation of insulin resistance. What is basically acanthosis nigricans? It is skin manifestation of insulin resistance. Is it okay? So it is not metabolic syndrome. Metabolic syndrome is something different. After 35 there is 39. This is ground glass appearance. Which cyst is this? This is chocolate cyst. And it is 8 centimeter. As I already told you, if it is more than 5 centimeter, cystectomy is needed. Okay. After 39 is $28. Before 39 was 38. 38 was Dr. Champ question. Dr. Champ, listen carefully. You have asked why it is not adenomyomatosis. Because there is dyspareunia, right? And there is infertility. Dyspareunia plus infertility. Okay. And what is the age group? 29 years. What is the age group of endometriosis? Endometriosis patients are of your age. Okay. 25 to 35 years. Okay. And adenomyosis patients are of my age. After 40 years. After having child. Is it clear, beta? Beta, we will do it today. Question number 40. Dr. Rakesh is asking question number 40. Beta, it is a 6 centimeter fibroid. Question number 40 is 6 centimeter fibroid plus menorrhagia. Okay, plus menorrhagia plus menorrhagia. Okay. So as the lady is 45 years, the most cost effective treatment is hysterectomy. Dr. Rakesh, is it clear to you? We have already taken question number 29, Dr. Rachna. Let us, okay, we haven't taken. Yeah, this was very important. Many of you did wrong. Question number 29. Prolactin level maximum. Listen carefully. Listen carefully. With pregnancy, or you can say as period of gestation increases, prolactin level increases. Just after delivery, there is fall in prolactin level due to estrogen and progesterone withdrawal. Okay, Dr. Rachna, is it clear? Now, after the delivery, prolactin level are maximum after lactation. Okay, they are maximum after lactation because when newborn lactates, then two hormones are released. Prolactin, which helps in further lactogenesis, and oxytocin. Okay, this question has been asked in NEET PG. This is PYQ of NEET PG. It was left in puerperium. It is ideally a question of puerperium. Any other confusion which is left, please ask. We are taking 48 and 49. "48 is high prolactin are seen in all except." When are the high prolactin seen? Already it has been discussed. In pregnancy, after lactation, hypothyroidism only, beta. Due to some drugs like phenothiazines, then it is due to micro or macroadenoma of pituitary. Okay, let's take question number 49. Dyspareunia is seen in. Question number 49, they are saying adenomyosis. Beta, in adenomyosis, there is no dyspareunia. When is dyspareunia seen? Dyspareunia is seen if there are adhesions in peritoneal cavity. Okay, so when there are adhesions, Dr. Champ, the adhesions are there in PID and endometriosis. Is it clear? Dyspareunia is seen only if there are adhesions in peritoneal cavity. Dr. Isra is asking 13 and 15. Okay, let's take it. Dr. Isra, in the question number 15, we use some fluid media to distend the endometrial cavity while hysteroscopy. Okay, now there are two types of medias. There are two types of fluid. NS, or you can say ionic, and non-ionic like glycine. Okay, as ionic solutions, they get, yeah, what is TURB syndrome? Yeah, like, very good. Ionic solutions are can be maximally, the fluid deficit should be 1500 ml, 1000 to 1500 ml, right? Whereas glycine can go up till 2000 to 2500 ml. Is it clear? Okay. Now next question is, you have asked us 13. Beta, the basic pathology behind endometriosis is hyperestrogen. So we cannot give estrogen. Yeah, you're right. Okay, Dr. Isra, we have to give the drugs which decrease endometrial proliferation. So basically what we give is progesterone or GnRH analogs, right? Is it okay? Is it okay? Any other problem? 40. 40 has been discussed. Let's discuss it again. As it is a case of fibroid with menorrhagia and the age is more than 46. So the treatment becomes, mifepristone can be given as it is So the treatment is hysterectomy. Let us take question number 20. Question number 20 is same beta. What is the basic pathology in endometriosis? Hyperestrogen leads to increased endometrial proliferation, which leads to menorrhagia, which leads to backflow, which cause endometriosis. Is it clear, beta? Dr. Rakesh, is it clear? Is it clear? Any other query? We will be doing just after this query section. Dr. Isra, we will be doing just after this query section. 5-minute breaks. After these queries, there will be 5-minute break. And then we will be having the labor class. Any other query? Please feel free to ask. 16th question, image wala. Okay. What is in the 16th question? See, in the pelvis, there is a white color round structure, right? So what happens here, in the lady is postmenopausal, 55 years, right? Okay, now you tell me what happens to fibroid after menopause? What happens to fibroid after menopause? Tell me. They undergo calcific degeneration. They undergo calcific degeneration. Okay? So once it is calcified, it will look white on X-rays. Now let us see the other options. Bladder stones are not here. Okay, bladder stones. Now this image was This image was in center. Bladder stones are inside. Okay, and are at side. And next is that ovarian cyst is not calcified. Ovarian cyst and impacted bowel is not calcified. Okay? Is it okay, Dr. Rakesh? Question number 25. All of you see the question number 25. See, the patient was having the patient was having infertility. Due to fibroid. What do you think when fibroid causes infertility? Most commonly, it causes infertility, bacha, if it is coming in between the path of sperm or ova, as here the fibroid is at the cornua, so it is not letting the sperm to enter. Okay, so we have to remove, Dr. Isra, fibroid, then only the sperm will enter. Is it clear? Fibroid at cornua does not let sperm to enter. If we will give anti-GnRH, then fibroid will decrease in size. It will not get removed. Is okay? Any other query? Is it okay, Dr. Isra? Clear? Is it clear? Any other query, please do ask. In the late stages, Dr. Isra, we give GnRH analogs. Okay. No further queries? Should we close the session? Permission given. Should we close the session? Just after 5 minutes, we will be having the class on labor topic. It's a very important topic. In adenomyosis in ultrasound, sandpaper appearance. Okay, one query is still left. Let me see that. Either it is salt, pepper, appearance, or it is sandpaper appearance. In adenomyosis. Okay, beta. Images are already there in Telegram. Anything else? Dr. Rakesh, is it done? Can we close? Okay, Dr. Isra, Dr. Sumit, Dr. Rakesh, is it done? Okay. We are closing the session. Thanks for joining. Do like, share, subscribe my channel. Within 5 minutes, we will be back with